The biopharmaceutical drug market is expanding at an unprecedented pace, fueled by groundbreaking innovations and the rapid adoption of new therapies. But with progress comes complexity, soaring costs, evolving regulations, and persistent access challenges. How is the industry adapting to navigate these hurdles? And what strategies are unlocking new opportunities for patients, providers, and innovators alike? I'm Michael Sarshad, your host, along with Sarah Rubin, for this special series of the Syneos Health podcast in collaboration with Assembia and the Specialty Pharmacy Summit. In conversation with key thought leaders and industry experts, we'll explore the dynamic forces shaping the market today. Tune in as we discover key strategies, industry trends, and collaborative innovations driving the future of market access and specialty pharmacy. Welcome to the Syneos Health podcast, Navigating Modern Market Access. I'm Michael Sarshad, Managing Director at Syneos Health, and your host for this episode of Syneos Health Podcast Special Series, Navigating Modern Market Access. We're recording from the floor of Assembia's AXS 25 Summit, and today I am joined by Kim Plesnarski, SVP Market Access and Patient Support, Syneos, and Kelly Carter, Associate Vice President of Patient Support, Amgen. Welcome to the Syneos Health Podcast.
Thanks for having us. We're excited to be here, Michael.
All right, let's dive in. I want to talk a little bit about patient support and what's going on in general medicine, specialty, all that obviously fits in theme with what we've got going on at Assembia. So talk to me about the evolution of patient support services and how are we seeing it change in the near future? Kelly.
I think that it's rapidly changing. We see blurred lines between specialty and general medicine. We've had a lot of experience over the years of introducing complexities like buy and bill, high-cost products in the general medicine space. And I think what you've got to do is you have to adopt to embedding in workflows, meeting the customer where they are, and really investing in resources that are going to drive automation so that you can enhance the patient experience as well as the provider experience.
Absolutely. Everything that Kelly's describing is what needs to happen to address the macro environment. Especially products are becoming a greater mix of what is being approved as well as what HCPs have to prescribe. At the same time, we see a rapid evolution of technology, and we're seeing HCPs and patients, they're not only comfortable with AI, but they're demanding a better experience. And so that's where Kelly's comments really resonate to me, is they're expecting things to be easy, fast, seamless. And if you're not thinking about your patient support to be more modern, more engaging, personalized, faster, bigger, stronger, better, faster, then you've got it wrong. And we're seeing a lot of people start taking from a reactionary mode to proactive. So using predictive analytics, precision targeting, incorporating AI into the workflow for efficiencies, and to even move the experience so that your human resources are more focused on more important activities and really drive an impact for your brand.
Let's pause on AI for a second. You talked a little about the HCP and general med HCPs, and you all just did a panel on it, and you had some very interesting stats. You reported that on average, it's taking them about 30 minutes to do a prior auth for specialty meds. That's about a 50% increase in workload. Now, mind blown, 30 additional minutes that the PCP, which doesn't even have 2 minutes to talk to people, it's going to take them. And as a result, 7 out of 10 of them are avoiding specialty products in the PA process. So how are manufacturers, partners, support services, how are we helping them in this journey?
I think what we need to do is we need to stop contributing to the workload burden. So if you think about traditional patient support services, it always starts with an enrollment form. It's cumbersome. You've got a portal, multiple portals that you've got logins for, and you're dealing with more than just one product and one manufacturer. And so we have to think differently about embedding in the workflow, as I talked about. We have to think about putting in resources that are frictionless, like a non-dispensing pharmacy, for example. Can you e-scribe? You take the enrollment form completely out of it. I send the script just like I would send it to a pharmacy, and then that actually springs the resource into action. Based on that, you can also leverage modalities to engage with patients through text messaging as well as AI, which I know we're going to get to. But I think as manufacturers, we definitely have to realize where we're contributing to the burden. We need to think creatively about other areas where we can integrate to be part of the process and make it more seamless to this office staff day to day.
I'm going to piggyback off Kelly, this is really specialty not being the domain of the specialist. You have to take what works in specialty and bring it to Gen Med. She's curating a retail experience on a specialty product. And I think there's that assumption when I'm dealing with Gen Med and I'm a marketer, if I put in patient support, if I put in an FRM, I'm sending a message, this product is hard to access. You're not sending the message, the payers are. Your HCPs are already saying, I'm spending an extra 30 minutes per patient. I don't have time. It's a 50% increase in workload. More of the pipelines are specialty in nature. So you have to curate that seamless experience. And I think just reprogram yourself to let go of how things were in retail where it was covered, it would go to retail and be filled, and think about how you curate that on a larger scale. I think with FRMs, they're important as well. They're traditionally not in Gen Med. They're very common in rare specialty. We're starting to see them play more in the Gen Med space across the board, especially in chronic conditions. It's just going to keep increasing. It's an expensive resource. So you have to use precision targeting, be thoughtful, be able to leverage technology to answer simple questions and get ahead of it. But you have to have a resource even more so there. Gen Med is juggling many more patients in therapeutic areas than a specialist. So if you're saying, where do I need to help out more? It's probably there, but you have to do it at scale.
I would even jump in to say, don't reserve FRMs just for launch brands. We think about deploying an FRM resource to make sure that we're creating a positive experience when coverage is at the most volatile stage of the product. But the product is going to evolve over time. And especially if it's in the medical benefit space, you're constantly going to have evolution of claims denial, the evolution of billing. To me, an FRM is an extension of a manufacturer's patient support programs. And when you continue to keep them in the field, it sends a message that that manufacturer is actually investing in that product for the long term. So I would encourage folks, especially in general medicine, where we're starting to dip our toe into it, they are even more important because of office turnover, but don't reserve it as a short-term resource. Really think about it as a long-term lever, if appropriate.
That is definitely something I hear a lot from customers is, I only need it for a year or two, or I'll only deploy it after I have coverage. I hear you loud and clear. Rethink the art of the possible, and in those later life cycles of your brand, how you're really maximizing pull-through and profitable volume. And FRM could be a tactic that you use.
And just for audience members who may not know, FRM is
Field Reimbursement Manager.
And their main responsibility.
They're there to help patients navigate coverage and affordability. And so they support the HCP office, making sure they understand the payer requirements, and help them pull it through.
So speaking of payer requirements, we're seeing payers become more and more restrictive. Access is becoming tougher. Affordability is becoming a major barrier. Patients aren't able to receive the medication they like. We're seeing recession signals. We may already be in a recession. Who knows? But at the end of the day, working with payers makes things quite challenging. So how are we seeing this play out in the marketplace with access becoming more restricted and patient affordability becoming more of a challenge?
I think the opportunity is education. And what we talked about in the podcast is breaking out and really defining the difference between coverage and affordability. There's this coverage aspect where we know that coverage is going to be there early on and may continue through the life cycle of the brand, but it could be challenging during various cycles of the life cycle there. And that's where the FRM, I think, comes into play. That also creates the operational burden on the HCP. You could have an HCP office that's completely committed to getting this patient to the finish line, and then that leads me to affordability. And then the patient says, hey, thanks, but no thanks, I can't afford it. And they may be in a plan where they could have influenced the path that they were on to be on a medication that was more affordable. So when we think about the patient affordability journey, it's challenging, especially from a manufacturer perspective, because we want to get the education out there, but oftentimes we're not interfacing with patients directly. So we have to start thinking creatively about how do we educate them on things like accumulator maximizer? Understanding, hey, I've got a commercial copay card, but why do I have a bill? Also having them understand the differences if they're a government-supported patient and they're over 65. Is Medicare Advantage too good to be true? And what does that mean for me in the list of medications that I've been prescribed and I've been on potentially for several years? And then you've got a little bit of this uncertainty around Part D smoothing, which I think at the essence of it is really well intended for patients. It's designed to smooth out the cost over time, but due to lack of awareness and lack of education, unfortunately, it's resulted in less than 1% of patients even enrolling. So it's a missed opportunity for us to educate patients on the evolving payer environment and help equip them with the knowledge so that they can make appropriate decisions come October when they've got open enrollment.
Hot take. Kelly, should we just transition the discussion around coverage and really just make it only about patient affordability, or do you think we really need both?
I think it's a little bit of both because they need to understand what the payer environment looks like. Affordability is a piece of it, but they may actually opt into a payer that either does not have that as an option. They could be a commercially insured patient that's transitioning to Medicare. And we've seen this oftentimes with some of our larger biologics. They've been on a product for many, many years. They make that transition into Medicare and they're like, why can't I get it? So I think educating them on what is available, what options are at their fingertip is part one. Part two then is how do I make a smart choice based on my options to make sure that I'm choosing the most affordable option for me and my family?
I agree. To me, they're one and the same because you have to be thinking about both. And this is where your field reimbursement managers, your hub staff, your patient navigators, they're the tip of the spear, but they have to have that feedback loop back to your managed care team in-house, your patient advocacy, your marketing, your brand. You have all these payers, they're vertically integrated, but not every healthcare plan is the same. There's thousands of versions and it's driven by employer groups. Your FRM there is to navigate that complexity for the HCP office to get the patient the information they need. But there are flaws in the system. And your FRM needs to identify those trends and bring them back to the managed care team so they can sort it out with the payer. So that may mean inaccurate prior authorization requirements that are driving up workload and wait time. It might mean there's a large employer that has put in an alternate funding plan for your brand. That means those patients aren't covered, but they think they are because it says they're covered, but they're really not. And the better you can understand that from your frontline staff that can see that transparently, communicate that on the ground, and then have that feedback loop, then the manufacturer can take some action to improve it. But it's really complicated, and coverage, when I see on the stage for 90% coverage, I sometimes cringe being in patient support because I'm like, coverage is good, but sometimes only 40% of patients that get written the product actually receive it. That's not great, and that's that affordability access component, and it just needs to be more front and center.
Yeah, coverage is great if you can afford it.
Yeah,
Exactly.
Afford it. What's the point of coverage anyway?
Yeah.
You talk about shortening the cycle, making that feedback loop a little bit more seamless. Now let's talk a little bit about technology and AI, and how are we seeing technology being used to support this journey to reduce barriers in specialty, but also in gen med?
So I think with AI, I keep saying it, I say it to my staff, we're heading into the frontier where we're the last generation to manage just people. And that means AI is part of the team. And their extra staff and their staff that can now start thinking on its own. So you don't have to always prompt AI. That's where we're headed. And what does that mean for manufacturers and our partners? It means you can start automating tasks. You can start predicting outcomes and being proactive. So a simple example would be you engage with a patient. You have all their demographic, socioeconomic information. You can use behavioral science to say, is this patient high risk to be afraid of an injection? Are they high risk to not fill their prescription because they are living paycheck to paycheck? And do a proactive approach to coach them and get them resources that they need, as well as education. Today, a lot of programs are reactive. You wait for a patient to tell you there's a problem. And of course, you can intervene then, but it's not a great experience. And it's the same thing from an access perspective. You can look how an HCP behaves in their staff and their approval rates and start saying what education do they need to get better at the process so that there are less delays. And AI is going to help power that up. And so when you do deploy a human resource, whether it's to do education, a HCP or a patient, they're armed with the right message and they're not doing the research. So they're going to be way more effective. To me, those are the baby steps and they're in place. I know Kelly's going to talk about AI agents, and I want her to because that's the scale component that's really needed in gen med.
Yeah, I can totally relate to the reactive nature that you're talking about. And I think fundamentally as a manufacturer, we have to shift the way that we're thinking about and how we're serving patients today. To me, it's about speed, accuracy, empathy. And how do we integrate that into our operational model? And I'll tell you, my agents are excited about the opportunity to work with AI. They do not feel threatened, which I think is great, because what we can do is we can get to the heart of what the need is. My goal would be if we could deploy an AI agent up front and get rid of an IVR, which I call choose your own adventure, choose option 1, choose option 2, choose option 3, instead of getting you to the wrong place and passing you around like hot potato, why don't I just have an AI agent answer the phone and show some empathy and ask you a couple of questions? I can work with that technology to enroll in copay, to give them a copay balance, to educate them on what we were just talking around insurance operations and how things are going to change. And then I can reserve my staff for complex problems. And I'd love to leverage technology to give me a synopsis of what the AI agent talked to the patient about. It feels like a seamless handoff to be able to resource appropriately and make your operations run as smooth as possible. These are things that we're thinking about. I can't sit here today and tell you that I can give you success stories off the bat, but I'm a big dreamer, so I'm dreaming big. I know this technology exists, and we're willing to invest and I think pilot in these opportunities so that we can enhance the experience, not only for patients, but caregivers and HCPs that interact with our services.
You guys are ahead of the curve. I am seeing a little bit of the AI agent that you're talking about being piloted. I think for me, the one aha moment is patients are more willing to ask the AI agent the hard questions or the embarrassing questions because there's a zero judgment.
Good point.
They can get the insight if you're already aware that that is a question. But as a manufacturer, you'll learn that. You can build your agent to be able to answer that question. And then you can train your staff to be able to handle those more delicate conversations proactively. So there are some, I think, unintended positive consequences of having it that are actually going to boost quality and make these programs better over time. It's just the beginning. This technology just came out, so it's really preliminary. But I think teams should be looking for these moments, dream big, like you're saying, Kelly, and look for these moments where how can this make you better and how is it giving you something you didn't have before?
I think the reality that we all should call out in the room is AI is here. And I think that pharma in general is a bit behind. If you think about the retail environment, you can call Saks Fifth Avenue, you can call Nike, and you're going to be talking to an AI agent. And it has empathy, it asks questions, it's personalized, and it expedites the customer service that they're looking for. So I say that because we're becoming desensitized to technology because it's all around us. And I feel like once we have the motivation, and I feel that it's here in the industry to get this jump started, patients are not going to be reluctant to interact with it. And I love the insight of they may feel more comfortable giving more information, which may be very helpful for us to predict patient behavior.
I love the discussion around the transition from reactive to proactive. I mean, that's the epitome of our healthcare system, especially here in the US. We're always focusing on, okay, there's a problem, let's fix it. How do we become proactive? How do we use technology and the tools that we have available to us to become proactive, to predict what's going to happen and address it before it actually does? All right, time for our favorite part of the segment, boom or bust. So, is specialty in gen med a boom or bust?
Boom. Definitely a boom.
Excellent. You heard it here first. Thank you, everyone.
Thank you, Michael.
Thanks, everyone.
That's all for today's episode of the Syneos Health Podcast, Navigating Modern Market Access. I'm your host, Michael Sarshad. If you have any other topical issues you'd like to hear on this podcast, please send us a message at podcast@syneoshealth.com. For access to more future-focused, actionable life science insights, please visit the Syneos Health Insights Hub at insightshub.health.